Good morning, friends. Welcome to my Geriatric channel. In this episode, let us know about hypertension or blood pressure. Patients are very familiar with the word BP rather than hypertension or blood pressure. BP is one of the most important and interesting problems seen in geriatrics. More than one third of the geriatric population, that is, the senior citizens, are BP patients. It is an important risk factor for other diseases like angina, giddiness, mental irritation, hemiplegia or paralysis, and heart attack, and many more also. Hemiplegia is popularly known as paralysis. Okay. BP differs in a number of ways in elderly population from adult population or middle-aged people. BP is not a physiological accompaniment of aging. Development of BP depends more on environment of and its problems and lifestyle rather than simple aging alone. Therefore, some of the elderly people who are not BP patients tend to develop BP when they migrate to Western society. This is a very important aspect. Friends, now let us know what is BP, how it is measured, which one is the gold standard instrument to measure it. Increase in the peripheral vascular resistance, secondary to arteriolar smooth muscle vasoconstriction. That is the constriction of the muscles of the arterioles, leads to BP. So, the pressure exerted by the walls of the arterioles on the column of blood in them is called the blood pressure and is measured by an instrument called sphygmomanometer. Mercury manometer is the gold standard instrument to measure the BP in a person. Friends, bloodstream has to raise its pressure just to flow through the narrow arterioles of the end organs, that is, heart, kidney, limbs, brain, lungs, etc. Also, the low plasma renin activity and low aldosterone level in senior citizens are responsible to develop BP. Because of this aspect, calcium channel group of drugs are preferable to beta blockers in the treatment part of the blood pressure. So, BP is a risk factor to many diseases. BP by itself is not a disease with symptoms and signs. Many elders does not show any symptoms with very high BP as high as 200 by say about 150, something like that. Their high BP is detected by the routine checkup. When they come to the clinic, we measure the BP also and it seems to very high. But high BP has its effect on arterioles, heart and vascular tree, brain, kidney, eyes, and ears also. What levels of BP needs treatment? Friends, a few years ago, 160 millimeters of mercury systolic blood pressure and 100 millimeter of mercury diastolic blood pressure were considered normal for the elderly people, especially above 70. But now the times have changed, researches are going on, and now it is considered 140 by 90 millimeters of mercury is accepted as normal BP for senior citizens all over the world. So this is the basic level which denotes the normal BP in the senior citizens. Anybody having BP above this level needs treatment. The difference between systolic and diastolic blood pressure. For example, 140 and 90, the systolic difference is about 50 millimeters. It is known as pulse pressure. If a pulse pressure increases, it is a risk factor for heart disease. So, friend, this is about the first part of this episode regarding blood pressure. In the next episode, I shall come out with isolated systolic hypertension, pseudo blood pressure, and Osler's sign. Till the next episode, please go through this episode, like it, subscribe it, and share. Please note the subscription is free. Subscription doesn't carry any fee. Till then, thank you very much for viewing this episode. Jai Bharat, Jai India, Jai Karnataka.